position as regards external medical visits from general practitioners, for example? How did that change?
From our perspective, that changed dramatically, varying degrees, to be fair. There was some services where all visitation just stopped, so you didn't see a medical professional. It was all telephone assessments. There was some services where the GP's surgery was very proactive and was still in visiting people. But I would say the majority of cases it kind of moved to telephone assessment.
And it was the same for us. One of our homes, the service continued. The GP was tremendously supportive and came in, and they formulated a system between them so that the time the GP spent in the home was more specific and more organised, if you like. And then in other services, they didn't come in at all. It was telephone consultations.
And with those telephone consultations, did you find those to be an adequate or similar substitute for the physical version?
I don't think there's any substitute for physical assessment when we're phoning saying that there's somebody that's unwell. I think there, especially for using agency staff, and it's agency staff is phoning the GP about a resident who doesn't seem to be well for various reasons. That can be quite difficult when they don't know that resident and they're trying to relay information to the GP. So I think that physical assessment being missing had a huge impact.
Bearing in mind we are a care home, we don't have access to oxygen or ventilators, and our residents were not being admitted to hospital, which some may argue is a basic human right. If you are not well and you need hospital admission, that you should be allowed to have that admission and not be discriminated against.
You say in the organisational statement, I think, about the increase in attention, I think, that those with dementia required. Are you able to elaborate a bit more on what you mean by that? I think you have to an extent already, but if there was anything else that you would add.
No, not really, just that they don't understand. And when you have what was a familiar face, even if they can't remember your name, when that person is going in with a mask on and gloves on and apron on, they can't really work out who they are. So it increases their anxiety, it increases their fear, if you like, of what's happening.
Which leads me to ask this question, I suppose. Do you think that those with dementia were taken into account or sufficiently taken into account when these restrictions, this guidance was put in place?
No.
Should they have been?
Absolutely.
Absolutely, yes. Because I think they were affected mostly by this.
And I wanted to ask you more generally just about the impact on your residents. We've talked about lockdown, self-isolation, and of course visiting restrictions not being allowed. What would you say were the primary impacts that you saw, your members saw upon your residents as a result of these restrictions being imposed?
I think fear and anxiety, because for reassurance, you would automatically hold their hand or touch them to talk to them to reassure, and we couldn't do that. And when visiting when the restrictions were uplifted and families came in, it's natural that they just want to embrace for that reassurance, for that comfort and peace of mind. And we created cuddle curtains, which were really, it was just polythene, but allowed them to have that embrace. And both the resident and family, they just broke down through, a happiness and sadness that they were eventually able to embrace each other. But you just can't put a price to that. It is invaluable. And I think not having that, not being with their family, was almost as detrimental as the virus itself to their well-being.
Yeah, I'd agree with everything Lisa just said. I think emotional and mental well-being's not to be underestimated, and how it impacts people's physical well-being as well. So I think residents deteriorated as a result of the restrictions that were placed upon them. Visiting had an impact on that because they couldn't see their families, but I think also the restriction of limited movement and had a massive impact on people's well-being.
Paragraph 69, I think there's a description that's made that these visits were almost akin to sort of a prison visit, if you like, with no contact allowed and a guard supervising them. Quite strident language, I suppose. I was going to ask you, you answered it to an extent, but Scott, what was the experience of your staff in having to facilitate these visits?
I think staff on the whole felt uncomfortable. I think there was that expectation about here's what the guidance is, and the guidance, although it was called guidance, was like you've already heard, a set of rules that was expected to be followed. So I think there was lots of apprehension around if we don't follow the rules, what will be the consequence for us, and so I think people felt uncomfortable with that, and completely can understand why people would feel, relatives would feel that way about being supervised visiting their relative. Personal circumstances, I had a relative in a care home who my dad was visiting, and he made similar comments about, well, you're sitting 2 metres apart and wearing a mask. Can you hear what you're saying? But also, you're being watched, so you feel that conversation you're having can be uncomfortable.
And what would you say then to those relatives that perhaps didn't feel like they were being trusted, with their loved ones? What would be your response to that?
I think it was all coming from a good place about trying to keep people safe. I think there was certainly no intention that I'm aware of trying to be obstructive or difficult. In fact, it actually made the job that the staff are carrying out extremely difficult. So actually, it would have been easier for the staff not to have these things in place, but there was a real fear factor around doing something that's not in the guidance.
So I think you would add to that.
Yeah, and it is about following the guidance, even though we may not necessarily agree with it, then we would follow it to the letter. And even staff perhaps didn't agree with it when they were out, and with the pressures that were on us at the time, to have staff sort of in that supervisory role was the last thing that we wanted to have, but found it necessary because if a positive case was then detected after one of these visits, the consequences of that for us would be serious.
Yes, because I think the words that are used in paragraph 6 are professional duty, and I think that speaks to perhaps what you're saying there.